As a child growing up, I was the oldest child in my family, and I became interested in child development and, of course, a natural caretaker. That led to me studying clinical psychology and then learning about early childhood and early intervention, and I became a big believer in trying to tackle issues early so that it can prevent long-term problems. My name is Simone Moody, and I'm a clinical psychologist at Children's Mercy and Director of Psychological Services for our ADHD Specialty Clinic. What I do every day is I work with families to determine if ADHD is the right diagnosis. I also provide children and families, their caregivers, with tools and skills that they can use at home and at school and in social settings to help them be even more successful. Pediatric ADHD is one of the most common pediatric mental health conditions. About 10% of children have ADHD. So we see children in our ADHD services clinic from 2 to 17. So it may be a child who isn't quite diagnosed yet, who is having trouble or difficulties at home, and we want to be able to work with that child to give them tools and skills as early as possible. But we also want to help kids as they progress through school and adolescence to help prepare them to transition to adulthood. My approach to patient care with children and families is very collaborative. So I ask questions to learn about the child's background and see what the family's goals are, and then we work together to create a plan of care that meets their needs and their resources. I want families to know that I will do my best to listen and to provide care for their children, and that I approach each child and family as they are, someone who I can really help and they can really trust. And I do that as a professional, but also as a parent as well.